So this brain aneurysm is basically a very complex neurovascular disease where you see that the blood vessel, which has 3 layers in the brain, it just thins out and it balloons out. So thinning and ballooning out of a blood vessel is called an aneurysm. And why they are dangerous? Because once an aneurysm bleeds in the brain, it gives rise to a very dangerous brain hemorrhage, which is called a subarachnoid hemorrhage. And today, if you have 100 subarachnoid hemorrhage happening across the country, the 30 of them, they will not be able to reach the hospital. They will die instantly with a bleed of an aneurysm. Another 70 who will come to the hospital, they run a risk of having the aneurysm bleed again. By about half of them, they will bleed within the next 21 days. So it's like a ticking bomb in the brain, which needs to be treated. Now, this aneurysmal subarachnoid hemorrhage, when we get a patient, the first thing that we do is we do a plain CT scan, which will tell us that there is a subarachnoid hemorrhage. Now, why a patient will come to us with a subarachnoid hemorrhage is because when there is an aneurysmal bleed, patient will experience a thunderclap headache, most severe headache. Typically, the patients will say that this is the worst headache of my life. So once a patient comes with the worst headache of his life, then we do a plain CT, and the CT shows the blood in the subarachnoid space. So we suspect it's an aneurysmal subarachnoid hemorrhage. And once there is an aneurysmal subarachnoid hemorrhage, we can do an angiogram, which can happen through a CT angiogram, or MRI, MR angiogram, or a DSA angiogram, that is digital subtraction angiogram, which is the gold standard in understanding the neurovascular diseases of the brain. And once we have diagnosed that there is an aneurysm, we will look at how many aneurysms are there, what are the sizes, and what is the location, and what is the morphology. Especially, we just look at the dome to neck ratio, if it's a wide neck or it's a narrow neck, or it has a pseudoaneurysm. All this complexity we study through an angiogram. And once the angiogram is done, then we plan for the treatment. Now, what are the treatment available today for brain aneurysm? There are 2 distinct ways to treat brain aneurysm. One is you can do an open surgical clipping. The other one is endovascular without opening the brain. Endovascular treatment for brain aneurysm has picked up very well, and it is rapidly progressing, especially in the technical front and technological front. So we see variety of treatment in endovascular arm for brain aneurysm. The first one is there is an aneurysm, balloon-like swelling. We put a tiny little catheter from the leg and go into the aneurysm, and we put platinum coils and get rid of this aneurysm. Then we have balloon-assisted coiling, where we put a balloon in front of the neck of the aneurysm, and then we go into the aneurysm and we coil. Then we have a stent-assisted coiling, where we put a stent into the parent vessel and go through the stent into the aneurysm and then coil it. Then the most recent advancement, which has almost revolutionized the way we look at brain aneurysm, the large aneurysm, the giant aneurysm, is a flow diverter. What is a flow diverter? Flow diverter is a very close-knit, closed cell stent, which we put inside the blood vessel which is having an aneurysm, so that the blood, instead of going into the aneurysm, it get diverted into the normal vessel. Although we have another couple of devices which are like a web device or a contour device, they are also flow diverter, but they are put into the aneurysm. So we call it as an intrasaccular, inside the sac flow diverter, or extrasaccular flow diverter. So the extrasaccular flow diverters are very commonly done. They are very safe, simple, and reliable procedure for treating aneurysm, large aneurysm, giant aneurysm. And so this is how an aneurysm is basically treated. Thank you.